Right, and certainly we are in the month of January, and Shahzad, the importance of this month is now kick-starting our segment, and let's talk about a very pertinent issue that is afflicting not just Pakistan but across the globe, which is it is observed as the Blood Donor Awareness Month, and the theme of 2024 this year, January's Blood Donor Awareness Month, is celebrating diversity, inclusivity, and equity in blood donation. And obviously, we are going to talk more about it. For example, who is eligible for the blood donations and what is the requirements if someone wants to donate for that, and obviously what are the individual risks in blood donations and the resulting diseases that stem if we are not careful about the blood donations. For example, HIV/AIDS, for example, hepatitis, and we've seen especially few years ago that Pakistan was a breeding ground when it comes to the transmission of the HIV/AIDS because of the blood donation and because of the unsafe equipment and tools that were used by especially the quacks and people's proclivity to move towards the quacks instead of following the doctor's recommendation. So we are very glad that we have been joined by one of the very important doctors. He happens to be a gastroenterologist and a liver specialist, and he's from the Maroof International Hospital. Thank you so much, Dr. Usman Aftab, for joining us, and thank you and welcome to our show.
Well, thank you for having me as always.
And it's wonderful to have you over here. So we're talking about Blood Donor Month. You know, I have a story to share. Obviously, when I was a university student, every now and then we would have these blood donor camps, and we would certainly go, and that too so that we could get some free juices and whatnot as well. It's beautiful. But for all of those people, because I guess that this day specifically means to kind of highlight the generosity of the people who've been saving lives and who've been donating blood. So we'll start from there. But how important it is for any healthy individual to donate blood. Let's get started from here.
So it's very important, to be honest. And in the same vein of the day, the same spirit, I think it's more of the acknowledgement of we can give to the people, others suffering and sacrifices. This is one of the acts that you can do as an individual, as a common man. You don't have to be a big shot or in an army officer or anybody. Yeah. This is how you can play your part in the general upbringing and safety of your community. Wow. So in terms of, there are lots of myths about blood transfusion or blood donation. Your blood cells die within 120 days regardless what happens. So it will replenish yourself anyways. Your blood will recycle. So if you give blood donation, it's a very small amount of blood that we take, about 400 to 500 mils, and that is it. That's even less than a liter. This rejuvenates your blood cells. This kickstarts your bone marrow and your blood producing cells in your body, which enhance in other ways just push your health in the right direction, and it's like just kickstarts your system. So yes, it's the best kind of deed. You're helping others and then you're helping yourself. So I think you lose nothing and you're helping others.
No, but you know, there are always people who, you know, who are not certainly willing to donate blood as well, because they're not very well aware of the health benefits of what's going to happen. So, you know, they're always confused. They're like, okay, pata nahi mujhe chakkar aa jayenge, you know, there's going to be andhera in front of my eyes, you know, things like that. You get to hear that as well. And for people who've already donated blood are the people who I believe are the ambassadors of, you know, kind of going to the people and kind of talking to them that, you know, that it will give you all the health benefits. So when we talk about donating blood, you know, do you think that anybody and everybody can donate blood, or do you think that there's always a distinction in between who can give or donate blood and who cannot?
Eligibility criteria, yes.
So first I'll answer your first question about apprehensions. I think most of the people are apprehensive of the needles rather than the act of giving itself. Most people are in fear of that. I think people who are having second thoughts should just visit the doctors. I think you rightly said in the beginning that students are our nurseries to get blood. So if you once seen what your blood does to others' life, I will tell you there will be queues outside to donate blood.
But not at the cost of not knowing what it will do to my life as well. You know, so this is something which we would want people to know today.
So health benefits, as we discussed, are there. There are research about cardiovascular benefits as well. There are researches about, well, I won't say weight loss, you lose some calories, but I think that's more to do with kickstarting your system. But blood pressure benefits, people who have blood pressure problems, they get better. So the myths around who is eligible and who is not eligible. Funnily enough, nature and Allah has made us in different colors, breeds and everything.
True.
On the inside,
Everything is
everybody's
same.
blood is
Yeah.
color is the same.
Oh,
Heart's color is the same, intestine's color is the same.
Wonderful.
So all we need to be, don't be worried about if you've got diabetes or blood pressure or other problems. If you're in a general good health, you're not anemic, that means your blood level is not low or not known to have low hemoglobin level, and you don't have any communicable diseases like we said HIV, hepatitis B, treated hepatitis C even at the moment is not. Now this is where health sector has to play its part as well. Careful screening, which is part of the WHO and national criteria and even Pakistan's criteria as well now, that every blood that is transfused or donated has to be screened prior to withdrawing blood. So the criteria for not giving blood is very small and minimal. So that should not shy away people from this.
No, and is there a minimum weight as well that, okay, you really need to weigh this much, to give away, or donate blood?
You should not be malnourished. You should not be skin and bone, because I think that will be cruel.
Right,
because we have seen people, you draw 1 pint of blood and you end up giving them 2 of your own. So, if you're in a good general health, not underweight, good body mass index above 22, you should be fine.
Wonderful.
But, and thank you so much for saying that, and especially for alluding to the importance of screening, because I was going to ask you this question, and especially we've seen in Pakistan that there was an outbreak of HIV/AIDS because of the, the unsafe practices that were carried out, and especially the blood donations that are carried out. So if someone, as a lay person, right, if I want to donate my blood, so what is the criteria that I should follow, especially coming from someone who is an expert like you in that particular field? So what are some of the check boxes that I need to look at and then go and, do the blood donations?
So what I would always recommend is, once you've decided that you want to donate blood, you pick the government approved centers.
Okay.
So don't go to willy-nilly centers, bigger hospitals. If you're worried too much about it, then what you can do, the only way you can get transmission being a blood donor is the blood collection set. So people who are apprehensive in our field as well, there will always be people who are apprehensive. So what I recommend is that you can buy your own blood donation kit from a vendor of your choice. It's freely available. I think that's what you can do. The other flip side of it, in Western world even, we've found a lot of people who come forward for blood donation get to find out that they've already got something.
True.
So that's let's say a free screening check for yourself, a free health check for yourself as well. But if you want to be sure of what you're not getting into trouble, is go for government approved centers, bigger hospitals, and obviously if you're too finicky about it, then buy your own kit.
Right, exactly. Buy your own kit, and if you do not feel like it, at least start advocating other people if you're not doing it as well. Only, as Dr. Saab has actually kind of alluded to it as well, that if you're scared of the needle, kind of ask your friends that, they might be helpful for other people. But now, sir, there's another challenge. Now, imagine that in the recent times, we have seen people suffer from COVID, we've seen people suffer from flu, we have some ill viruses around us where people, it's getting difficult for them to get better. Now, imagine that for that period of time, and people who've actually been, given those vaccines and whatnot, and there are other illnesses which are around, and specifically in winter season, we do see that there's a reduction in blood donation. How do you think that we need to spread awareness amongst people that, okay, even if you had COVID, even if you had the vaccine, it's perfectly okay to go and donate blood as well? And why do you think that we see a decline in blood donation specifically in winter season?
So the reason for choosing January as a blood donation month was this specific thing, that we should tell people that this is okay time. I know, and you're rightly saying it's America. There were a lot of my sister who's a cardiothoracic surgeon in America. She came across people who were needing heart transplants and bypasses, and they refused to take blood from people who've got COVID vaccines.
Exactly.
So this misinformation is not just in Pakistan, this is everywhere. Now, yes, people will have seasonal illnesses. Simple seasonal illnesses will not get transmitted through blood transfusion, and it will not harm you for blood donation. Yes, I agree, people who've got respiratory problems like COPD or asthma, if they are worried about it because they are more prone to get chest infections or flu-like symptoms, they can take a rest for a couple of months as well. But you can plan this. If you are an avid advocate and avid blood donor, you can give it in September and October and give this, because we always tell people to wait for about 3 months to replenish yourself before you give.
I was about to ask this because someone told me that, that it's a 6-month cycle and you should come back after every 6 months to donate blood. But now you're telling us that, it takes almost 3 months.
3 months. 120 days is the life of an RBC, which is the red blood cell. So regardless, it stays in your body, it bleed it out, whatever, it will recycle.
Exactly.
So might as well just give it to somebody who it will help.
And in addition to that, we have seen the transfusion of blood platelets as well, and specifically in times of COVID. So how many times do you think that it's rather blood donation, or is it more of platelet donation in these times that we live?
So the good thing is, when you choose your blood donor center, they will tell you what is the requirement these days. So if, like in COVID times, there were shortages, or dengue times when there are outbreaks, governments and the institution health sector needs platelets more. So this is why it's best to present yourself to the center, who will tell you which is the requirement at the moment. I would take an opportunity for people who've got a negative blood group. I think in Pakistan, because we are more positive prone blood group as a society, people who've got negative blood group, I urge them, request them to make yourself, to present yourself to these centers. They might not need your blood then. What they can do is they can take your numbers and contact details, because we have ran around in hospitals and everything, especially in major catastrophes, when we need the negative blood group.
True.
So I think that's a rare groups.
And is it probably because of the fact, so I'm kind of getting awareness and I'm getting educated by whatever you're saying. Is it because that the negative blood groups can actually be given to any other blood group?
So technically, yes.
Okay.
The first protocol is always group matching. Type group match we would like to give. In major traumas or major surgeries or major blood loss, like when we have the calamities and catastrophes, this is when, yes, negative, same type can go, like a B positive can have a B negative blood.
Okay.
O negative is the gold. So because it is a universal donor.
Yeah.
Exactly. It's a universal donor. But firstly, we try to group match, but in shortages, obviously, negative blood groups can be given. But the problem is for people who are injured or they need blood group who've got O negative themselves.
Yeah,
they can only receive blood from O negative people. So this is why I say, notify yourself. It used to be part of our driving license as well.
Yeah.
Tell them it's a service that costs you nothing.
And Dr. Saab, what is this demarcation of different blood types? For example, you talked about positives and negatives. What are the implications of that, right? And as someone who's from this particular field, enlighten us about, why is there any, dissection of these particular blood groups, and what does that denote?
In layman term,
right,
basically is plus and minus is because of rhesus. This is antibody antigen on a blood.
Okay.
So what happens in people who've got positive, they've got that.
Okay.
Now what happens is, if we give that positive blood to somebody who's negative, or we give a B blood group to an A blood group, this will cause an immunological reaction.
Okay.
Because A and B will start fighting with each other. This is why plus and minus will fight. People who have minus negative blood group, they don't have that rhesus anyways.
Okay.
So they don't have anything to fight.
Okay.
So this is why it is more easier to give.
They're fine with any positive or any negative.
The gentle people, I will advocate for. I'm not negative, but I would like to say negative people are better in this case.
Yeah, only we're talking about blood types, ladies and gentlemen. We're not talking about mentally, okay? So please make sure that you bear that in mind as well. But now, sir, eventually let's come down to how much blood do you think is required away in Pakistan? For example, there are illnesses like thalassemia, other, cancer illnesses as well. There are burn centers which require blood, there are accidents. So what is the basic requirement of a country, God forbid, if we are to talk about, how blood donations will kind of work for other people out there?
So let me just give you a very horrifying picture. In our part of the world, and in Pakistan and the developing countries, the single most common cause of death is road traffic accident.
True.
Okay.
In young age group. And they die by shock. like blood loss and everything. So this is the young age group. Plus thalassemia and all, this is again, you see a lot of people, because it can run in the families, lots of people with low socioeconomic status can have these things as well.
Oh, yes.
So they need blood on regular basis. So the shortfall is like humongous.
Even with dialysis as well, do we require blood?
We don't need blood transfusions with dialysis, but problem happens is people who've got chronic kidney diseases, their blood is they're already anemic.
True.
The function is different, why they get anemic, but they do need blood from time to time.
True.
But not as a rule. But mostly it's road traffic accidents, people who've got thalassemia, like you said, people who are having major surgeries, like bypasses and etc. So even bigger centers are having shortfalls.
True.
Transplant centers, they need bloods and bloods and bloods. So there is always going to be a shortage, even if there was a national blood donation program. So we are a 224 crore population.
Right.
Out of that, I am sure at least half of them will be eligible.
Yeah, and 26 crore ballot papers are being printed as well. So I think we are close to 26 crore as well. But in addition to this, there's this one thing which I've observed very recently. So imagine that one of my friend's uncle, may he get well soon as well, he got burned. 46% of his body got burned, unfortunately. So what happened was that when we took him to hospital, the hospital asked us to donate as much blood as we can. You know, they didn't ask for any certain or specific blood group, but they're like, okay, whoever can go and just give a pint of blood, and I think that's going to be fine. Earlier, there used to be a mechanism where, you know, that the blood group really needs to match, and only then you can donate blood as well. So how do you think that the hospitals at the back end are managing that whatever blood's coming in, let it come in, and that we will manage for your patient? May it be any other blood group.
So basically, it's poor health sector, which is begging, borrowing, stealing, groveling, and just doing minnat samajit.
True.
What they are trying to do is they will take your blood. So like if I have blood B positive, you have A positive, you need A positive, I'm happy to donate blood. Hospital will say, or this center will say, fine. What we will do is you give us your blood and we will from our storage help your people.
Okay.
So because it's better for you, you don't have to run around and find a type match.
True.
But it helps them as well, because their cohort and their stocks are not replenishing. Otherwise, you will be running around the cities. I'm sure you have friends who keep calling everybody, I want blood for my father or sister or brother.
True.
So this is how health sector just tries to help people.
And in addition to that, there's one menace as well, and that is that, you know, that very story I actually shared with you at the beginning of the program. The sole purpose to share was that I'm going to end it over here. So imagine that they used to come to our, I'm not going to name it, but imagine that they used to come to our university and ask for blood donations, and were always like, whenever you will need it, we'll give you this card and you can come to us, then you will get free blood as well. Unfortunately, there was an instance where I needed blood, you know, for somebody. I went to them, I showed them that card, and they said that you have to pay for the blood. And I was like, imagine that these companies are coming to students in universities saying that, God forbid, if you will require it, you know, we will give it to you for free, rather they are charging money as well. I think that all of these malpractices kind of shouldn't be going unnoticed, and there should be people who should raise concerns about that as well. But very quickly towards the end, for a person who's actually kind of getting that donated blood, what do you think they need to do? First, screening, we've spoken about it. Are there other predispositions to that?
Just get yourself rehydrated.
Okay.
Hydrate yourself pre and post giving blood.
Okay.
Center will do your screening. You don't worry about it.
Okay.
And obviously, as a patient, how do you know that the blood that you are getting or the blood bank that you are getting is not, infected with some sort of disease or something like that? Is it possible?
It is possible. This is why I said first, government approved. Bigger centers, don't go to smaller, like unfortunately you had an unfortunate incident as well. So pick a government approved big center.
Right.
Exactly.
Right.
But thank you so much,
Thank you
Dr.
so
Usman, Aftab sir, for being with us and that
Thank
to
you so
talk
much.
about such an important month. Ladies and gentlemen, for everybody who's out there's one thing which I would love to mention today. Very sorry. And that is that I've always seen, I think this is something which is overwhelming for me, that I've always seen Maroof International Hospital's doctors being at the forefront of community service. You know, what they do in the hospital is something which they're treating patients as well. But for them to take out time, come over here, be on television and speak about all of these things which will certainly make us a healthier community is something which I would love to appreciate always. Thank you so much for joining
Thank
us.
you so
Wonderful
much.
to have you over here. And for everybody who's out there where we've spoken about the health, I think we really need to talk about a little bit about law too as well
True.
today. So ladies and gentlemen, don't go anywhere. We will be right back.